affecting men well for this disease. To interact with us, 0775 prostate cancer. In studio, we have two gentlemen, Tendai Sangweme, and we can't quite hear you, Panache. But let's start with you, Tendai. What are some of the most common risk factors of prostate cancer, and how can men reduce their risk of developing this disease?
Okay, thank you so much for that question. So for the benefit of our listeners, I would want to first of all try and give a basic anatomy of what the prostate gland is. So if you look in the pelvis, we have got our bladder, which is the one that houses our urine. So just below the bladder, that's where we have the prostate gland, which surrounds our urethra, the ones which we use for urinating. So when we talk about prostate cancer, is whereby we have the normal cells of the prostate gland becoming abnormal. That's when we then have all the sequelae and symptoms of this cancer. So in terms of the risk factors that may predispose a person to actually develop this cancer, we basically classify them into what we call modifiable and non-modifiable risk factors. So modifiable risk factors are those that we can change basing on our lifestyle and what we do. Then the non-modifiable are those ones that we cannot change. So starting with the non-modifiable risk factors, we've got age. So it has been shown that there is a greater increase in the risk of developing prostate cancer in males who are greater than 65 years of age, as opposed to those that are below 40 years of age. So many people have always said that if a man lives long enough, they actually get to increase their risk of getting prostate cancer. So we also have our second risk factor, which is ethnicity. So it also been found that for black people, they have double the chance of risk in terms of developing prostate cancer than white people.
Oh, is it? Okay.
Yeah. So this is something based on researches that have been done.
Well, based on science.
Yes, based on science. It's evidence-based. So we also have one of our non-modifiable risk factors is genetic predisposition. So in your family, if you've got a first-degree relative, it may be your father, it may be a brother, or anyone in the linear family who has once developed prostate cancer, either if below the age of 40 or at the age of 60, you've actually an increased risk than one without a family history of that prostate cancer. So it's been found that this cancer has a genetic component attached to it, which I may not really get into the gist of it. So for the modifiable risk factors, these are things that we can change using our lifestyle modifications.
Okay.
This has to do with things like diet. So you'd find that due to researches that have been done, things like high animal fat in our diets. So you're talking about red meat, taking a lot of unprocessed pork. So these tend to have chemicals that may actually be teratogenic and may predispose you to getting this cancer. We have also things like cigarette smoking and drinking. So cigarette smoking predisposes you to carcinogens, because carcinogen is just something that causes a damage on your normal cells, causing them to then do the cancer change and leading you to developing cancer. We have also things like infection and chronic inflammation. So by definition, for those who may not know, inflammation is so when you've got an infection, be it in your genital tract, that gets to affect your prostate gland, you've got your immune cells that then try and clear that whilst attacking normal cells of the prostate, which is more like a bystander damage. So that then also then predisposes you to getting this cancer. So there are also other other modifiable risk factors like obesity and also poor health literacy, whereby generally males in Zimbabwe do not really like to do not have a very good health seeking behavior. So you'd find that for someone who gets to be checked constantly, they actually have a better chance of early detection, which means a better prognosis going forward.
Got a message saying, does too much intercourse cause prostate cancer? And it's actually the opposite. It actually helps you when
Uh,
it comes to prostate cancer. Yeah. Moving on to Panache. What are some of the most effective screening and diagnostic tools for prostate cancer? And how can men access these? Because, now people are thinking in their heads, okay, I want to prostate cancer, but then totally, how can men access these services in their communities? Where do they go?
Okay, so there's several screening and diagnostic tools available for prostate cancer, and the most appropriate tests may depend on factors such as age, family history, and overall health status. So some of the most used tests include what called prostate-specific antigen (PSA) blood test. This is a test which measures the level of PSA in the blood, which can detect the prostate cancer in the early stage. So that's our first tool, and then the second one is digital rectal exam (DRE). So this exam involves a doctor or a healthcare provider inserting a gloved uh,
Yes.
inserting a gloved lubricated finger into the rectum to feel for abnormalities in the prostate cancer. So we can say if the abnormalities are high, so it's a suggestive way that someone might have what you call prostate cancer. So the third one is transrectal ultrasound, which is TRAS. These tests use sound waves to create images of the prostate gland and can help to detect also the abnormalities or tumors. And then the last one, the fourth one, is biopsy. So this one is if abnormalities are detected through PSA testing, DRE or TRAS, a biopsy may be recommended to confirm the presence of prostate cancer. So what you're saying is those three are tambotaro musoro, which are prostate specific antigen, digital rectal exam, and transrectal ultrasound. They are suggestive ways. And then if it was chance what you call biopsy, that's where patrogona utarot patrogona kuzoita a recommendation whereby you can say with the signs and symptoms of prostate cancer kune munhu.
Okay. Thank
And
you. Yeah.
okay, and also the last part iri kuda kuanswer how do men access these services. So men can access this service through my primary care providers, my urologist. These are specialist surgeons who treat with the problems of their kidney, bladders, prostate and male reproductive organs. And also the last one is my local health clinics. So that's where people can access these services.
Thank you for the information there. And moving back to you, Tendai, what are some of the most promising new treatments and therapies for prostate cancer? And how do these compare to traditional treatment options?
Okay, thank you for that. So just to give an addition to what Panisha said, maybe a more direct place that's doing prostate cancer screening. People can go to Cancer Association Zimbabwe in number 60 Livingstone. I think it's like $5. I know if people really get a good referral, that's when they would actually go and get that done. So in terms of treatment, so traditionally we doctors and urologists may have been using surgery, which is just resecting a part of the tumor or even the total gland. Then use radiotherapy and chemotherapy. So radiotherapy is whereby you use radiotherapy wells to actually fry out the abnormal cells. Then chemotherapy is just using medication that may then they're given by intravenous route to try and kill the cells. So with newer treatments that are coming, most of these are still in clinical trials. So the long-term potential has not yet been established, which means at apparent we are still using the modalities of our traditional treatments that have been mentioned before. But in research with things like high intensity ultrasound, whereby they use sonic waves to try and create thermal energy, which would be directed towards the abnormal cells to try and cook them out. Then there are also things like photodynamic therapy and cryotherapy. So these are technologies that are being developed but are still in clinical trials because their long-term sequelae and long-term effect is not yet been established. So they can't really be rolled out to the general public as of now.
Okay. If you're just tuning in, this program is brought to us by Say What, with support from the Embassy of Sweden in Zimbabwe and Stop TB Partnership. Remember to get in touch with us for psychosocial support and SRHR related services on our toll-free line 577, discussing signs and symptoms of prostate cancer. What are some of the most important lifestyle changes that men can make to support their overall prostate health? And how can these changes be integrated into daily lives, our daily lives? I know you touched on lifestyle modification, that it can actually help to keep it at bay. But then if you can get into detail. Sorry, I can't hear you.
With exercise regularly, that's our first point. So regular exercise can increase the risk of prostate cancer, can reduce the risk of prostate cancer, and improve overall prostate health. So it is recommended to engage in at least 30 minutes. Engage in at least 30 minutes of moderate intensive exercise per day, such as brisk walking, jogging, and stuff. And then the second one is maintain a healthy diet. A healthy diet, which is rich in fruits, vegetables, whole grains, and lean proteins, can help reduce the risk of prostate cancer. So men should also limit their intake of red meat and white fat dairy products like before. And then the third one is quit smoking. Yes, it's hard. I see smoking, but for you to be about prostate cancer, you should quit smoking. So smoking is linked to an increased risk of prostate cancer and other health problems. So quitting smoking can improve the overall health and reduce the risk of prostate cancer. The fourth one is monitor alcohol consumption. Yes, you cannot quit to consume alcohol, but you can monitor the consumption of your alcohol. So if alcohol consumption has been linked to an increased risk of prostate cancer, so men should limit their alcohol intake to no more than 2 drinks per day. And then the fifth one is manage stress. Chronic stress can weaken the immune system and increase the risk of prostate cancer. So men should find ways to manage their stress, such as meditation, yoga, and deep breathing exercises. We also have regular checkups. You cannot say that you might see that this cancer unoratidza kuona ma symptoms kwauri kumunhu, so you must do my regular checkups. Like, so men should regularly visit their healthcare provider for prostate exams and screening tests. This can help detect any potential problem early and improve overall prostate health.
Mm-hmm. Thank you for that information. So, just to add on how I answered the other gentleman saying does too much intercourse actually cause? So, scientists have found that no evidence that frequent ejaculations mark an increased risk of prostate cancer. In fact, the reverse is true. Yeah, if it's more frequent, it was linked to a decreased risk, not meaning that you should be reckless, right? Because you can then would you want to add on, Tendai?
Okay, maybe just a side note. Like you're saying, it's really an interplay between two things. So there are experts who have purported that like you're saying, kunyanya actually helps, but not kusonyanya kunyanya, because you then predispose yourself to zino, which may then cause you to get inflammation of the prostate. So would just probably say play it safe in that regard. Then in terms of smoking, so I'm a medical student, and we always taught that whenever you find a patient who smokes, do not lose the chance of discouraging them to smoke, because it has been found that there is really no much benefit that we derive from smoking other than harm itself. I know in drinking they probably say red wine will do you good at times, but with smoking, it's something that you may really want to look at. Then I would also want to stress more on health-seeking behavior by everyone, that find time to just go and visit your general practitioner, visit the local clinic or any health service provider to just get these health checkups, because you may be harboring something that may potentially shorten your lifestyle, of which just that 2 hour sacrifice in trying to visit someone who can then help you will better prolong, give you a higher life expectancy. So that's what I have on that.
Thank you so much, Tendai Sangweme, together with Panashe Chipfurute, talking about the signs and symptoms of prostate cancer. This program brought to us by Sewat with support from the Embassy of Sweden in Zimbabwe and Stop TB Partnership. Remember to get in touch with us for psychosocial support and SRHR related services on our toll-free line 577. We get to do this again next week, same time. Thank you for listening.
Be Candy on the Morning Galaxy, right here on Star FM.